Hi there, this is Laurie Edge-Hughes of Four Leg Rehab Incorporated, your place for online canine rehab education. And it is New Year's Day here just outside of Calgary, and it is absolutely beautiful out. So I thought instead of going down into my little studio and shooting this from my basement with some backdrop, I would have real nature backdrop for you, and it's just so pretty out here. Anyways, I want to give you an update on the book. I can show you, yay, it came in, it looks so pretty. Okay, on successful practitioners in canine rehabilitation and physiotherapy. So, I'm going to read you a couple of excerpts from this, because, and this is one of my favorite questions that I asked in various forms, in regards to why people felt that they had been successful. So I'm going to read to you some of these. So I've got them tagged off here. So the first one I want to read, the question, what in your opinion has led to failure of other rehab practices? And this one, I'm going to tell you, this is from Marty Peace. And Marty had worked or was a co-owner out at CRCG, which is in Colorado. A big rehab practice there, I think multiple practices. So this is her response. Basically, here we are. Too much overhead, non-effective marketing, not enough focus on marketing, to name a few reasons. Locations within a general veterinary hospital sometimes struggle because surrounding veterinarians are hesitant to refer. Any practice that has a rehabilitation practice within their doors needs to make a complete commitment to the success of that practice, including referring clients. Veterinarians often don't realize how time-intensive rehabilitation is, and that it's very difficult to treat more than one dog at a time. This is not how veterinary clinics are usually run. Often rehabilitation practices are not the money generator veterinarians feel it will be, because of the overhead and the time required. So I think some of the interesting points in there, and I'm going to bring these out because I've come to realize, I guess in some blog posts and various things, that not everybody reads things with an open mind, or rather, we all tend to interpret things with our own skews or our own biases. So what I would encourage people to do, and especially when if you buy the book, what I would recommend you guys do is read it with that kind of open-mindedness to say, okay, can I take some of that information, not take some of the information? What do I find useful in this? Because I think everything you read or watch or do has some tidbit of usefulness, and it's up to you to figure out what that useful piece is and how it applies to your life. So, okay, going a little deeper there than you likely expected. But, and I think what's interesting in this is that to look at the concept of, if you have a rehab practice within a veterinary clinic, that it really is imperative that all the vets at that clinic are bought in and are referring. If you want that to succeed, you've got to have buy-in from the vets that are there, not just looking for the referrals, but all the vets that are within that practice really need to be buying in and referring. So as an owner of a veterinary practice that has rehab, it's up to you to get buy-in from the other docs and to make sure that everybody is utilizing this service if you want it to succeed. There we go. That's my take on that one. So the next one I want to talk to you or read from here is an excerpt from Nigel Gumley, who's a veterinarian out in Ottawa area. And so the question that he's answering here is, what has been your biggest struggle in canine rehab, and what advice would you give other practitioners? So his reply: teaching the veterinary community of the unique services of rehab has been a challenge. There is a notion that rehab is primarily a post-surgical benefit, for TPLO, tendon injuries, etc. And while this is true, the majority of our patients fall into other categories. Other clinics have added rehab services for post-surgery, but lack the diagnostic skills for subtle lameness issues or problematic surgical recoveries. Differentiation between the two extremes of rehab is a challenge to a relatively uneducated market. Interestingly, numerous clients are more savvy and experienced, likely due to involvement of the dog sport community or with their own physiotherapy experiences. Also, the space required for rehab has exceeded what we thought we would need. The vet clinic pays premium rent for location, but the rehab does not need to be in such an expensive location once the diagnosis and treatment plan is established. I would advise others to spend some time in a rehab practice. There's nothing like seeing cases firsthand and practicing your skills. Reach out to the sporting dog community. It's huge, and these people are very dedicated dog owners who will talk up your service. Network with others who are offering complementary services such as massage, chiropractic, and acupuncture. Don't try to start a total rehab practice with no other income unless the market is used to what you're offering, as it can be a slow build. Having skilled therapists and assistants is everything. I do not have time to provide the treatment, so I defer to the PT and assistant to do this. I think the technicians are highly valuable and should be considered as more than assistants. I see myself as the diagnostician and the technician and the PT as therapists with different skill sets. Cool. I think what was most fascinating within that one too is the whole look at location of a clinic for a rehab only clinic. Because you need the space, really you don't need to be paying $30 a square foot for that space. Maybe you want to be looking at industrial areas. Anyways, I thought that was interesting, all of his points. And the last one I want to read to you is... question was, what are your strengths? And I'm taking the answers from Shannon Butaselic, who's a vet here in Calgary and used to work at my clinic. Unfortunately can't, because I'm not a vet and she's not a PT, and anyways, we had to... The Alberta Veterinary Medical Association made us part ways. But I have included... Oh, no. The question is, what have you found to be most challenging in practice? So here is Shannon's reply. I think the biggest challenge I have faced is that my practice philosophy is considered ahead of its time, so to speak, from a veterinary perspective. Veterinary medicine, although historically an old profession, has taken some time to advance relative to human medicine. And the explosion of new veterinary specialties is a relatively recent phenomenon, primarily driven by the needs and expectations of society. For the most part, the current regulatory foundation, at least in this province, is not yet set in place to allow for truly collaborative practice between veterinarians and allied healthcare professionals. Understandably, time and careful consideration are required to ensure that the best interest of all professional parties are considered when forming this framework. Much of my professional career by default has been vouching for the physical therapists that have helped to build this field. Flip. My fingers are starting to get numb. It's cold. And explaining to veterinarians that PTs are allied health professionals with a real sense of liability and professionalism, and that rehabilitation is a well-established field in human medicine. Oh great, somebody's driving up my laneway now. This not only validates what I do as a rehab professional, it additionally describes that what I provide is more than a complementary modality and is supportive therapy delivered in an entirely new way, which is not inferior to what I did when I worked in conventional rehab practice. The second challenge I face is that I get past the concept of looking at only the pathoanatomical lesion and the resilience and the reliance, sorry, on that x-ray being able to trust my hands more as my caseload and experience increased. I like to tell people that if I lost all my rehab equipment, I would get by with my hands and my brain, the most valuable and sought after tools I own. These tools, your hands and brain, give your clients the most useful information, and this is what they are ultimately paying for when they visit you. So there's 3 clips from the book, and I'm happy to share those with you. It's coming out soon. It's really, really close. So hopefully you find that useful, and hang in there. I'll give you some more updates, and we'll talk to you later. Thanks. Cheers.